Adenorhythm detailed information and precautions for use. Adenorhythm. 1. Drug name Adenorhythm. 2. Composition adenosine. 3. Dosage form intravenous solution for infusion. 4. Uses Adenorhythm is used to treat episodes of ventricular tachycardia, supraventricular tachycardia, and atrial fibrillation. It works by slowing down the conduction of nerve impulses in the sinoatrial node, preventing the emergence and spread of arrhythmias. 5. Dosage and administration. The dosage and administration of the drug are specifically prescribed by the doctor for each case, depending on the patient's condition, type of arrhythmia and the patient's response to the medication. The drug is infused intravenously slowly, usually within 12 seconds. 5. Dosage and administration. Close monitoring of the patient's condition during the drug infusion is recommended, especially blood pressure and heart rate. 6. Side effects. Central nervous system headache, respiratory disorders, bronchospasm, cardiovascular disorders, severe hypertension, asystole, cardiac arrest. Rare and often occurs in patients with underlying ischemia, heart disease, sometimes fatal. 6. Side effects. Nervous system disorders, syncope, fainting, seizures, especially in patients predisposed to seizures. Respiratory, thoracic, and mediastinal disorders, respiratory failure, apnea, respiratory arrest. Gastrointestinal disorders, vomiting. Blood and lymphatic system disorders, ischemia. 6. Side effects. Skin and subcutaneous tissue disorders, rash. Common central nervous system headache. Respiratory disorders, bronchospasm. Uncommon cardiovascular disorders, severe hypertension, asystole, cardiac arrest. Rare and often occurs in patients with underlying ischemia, heart disease, sometimes fatal. Nervous system disorders, syncope, fainting, seizures, especially in patients predisposed to seizures. Uncommon respiratory, thoracic, and mediastinal disorders, respiratory failure, apnea, respiratory arrest. Gastrointestinal disorders, vomiting. Rare blood and lymphatic system disorders, ischemia. Skin and subcutaneous tissue disorders, rash. Patients should inform their doctor if they experience any adverse effects during treatment with Adenorhythm. 7. Contraindications. 6. Sinus syndrome. Patients with second or third degree atrioventricular block without a pacemaker. Asthma and chronic obstructive pulmonary disease may cause further bronchospasm. Hypersensitivity to adenosine or any of the excipients of the drug. Long QT syndrome. Severe hypotension. 7. Contraindications. Decompensated heart failure. 8. Precautions. When using Adenorhythm, the drug can cause significant hypotension. Blood pressure should be closely monitored during treatment. Heart rate and EKG should be monitored regularly to assess treatment effectiveness and detect early side effects. 8. Precautions. When using Adenorhythm, caution should be exercised when using the drug in patients with heart failure, history of myocardial infarction, patients at risk of ischemia or cardiovascular disorders. The drug should not be used in pregnant or breastfeeding women. Store the drug at room temperature, away from light and moisture. 9. Drug interactions. Adenorhythm may interact with other medications, increasing the risk of side effects or reducing treatment effectiveness. Inform your doctor about all medications, including prescription drugs, over-the-counter drugs, herbs, and vitamins, that you are using. 10. Overdose. Adenorhythm dosage should be carefully adjusted to avoid overdose. If overdose is suspected, contact your doctor or the nearest healthcare facility immediately. 10. Overdose. Information about Adenorhythm is provided for informational purposes only. Patients should consult with their doctor for appropriate diagnosis and treatment. Do not self-medicate or change the dosage of the drug without the permission of your doctor.